Welcome to From Roots to Crown Academy of Dentistry. Today I would like to share a small product review on two materials, that is BIOSTRUCTRE MTA putty material and BIOSTRUCTRE MTA material from Endo company. I am using these two products since 2 years, and when I observed some of my cases which are having huge periapical lesions, and also at the same time there is a presence of any apical resorption and sealing the perforation defects, these materials have literally saved the patient's teeth, and also at the same time it made me sure that to give a success rate for those teeth which underwent so many defects. So today I would like to discuss these two materials which I have done using some of my cases. So coming to this BIOSTRUCTRE MTA putty material, this material is available in syringe form, which is having 0.7 gram percentage of MTA putty material in it. So coming to its properties, this material is having lesser setting time, that is this material sets around 10 to 15 minutes period of time. And coming to its handling material, this material is non-sticky in nature, so it can be easily taken from the syringe with the help of any Buchanan pluggers or any other carrier materials, and it can be easily placed into the respective canal morphologies or in a sealing of perforation defects or in apical resorption conditions. And also at the same time this material can even sets in the presence of a little moisture also. So this material can be used in a different clinical scenario, as it is a bioactive material. Coming to one of my case which I have done using this MTA putty material, here a 75 years old female patient visited to my clinic with respect to pain and swelling in her left lower front tooth region. On clinical examination, it revealed that there is a fractured restoration, and also at the same time there is the tooth that is mandibular left central incisor and lateral incisor was shown positive on percussion test. So coming to the radiographic examination, it revealed that there is a periapical radiolucency had been seen with respect to this mandibular left central incisor and lateral incisor, and also there is a small preparation of root canals had been also observed. So we advised the patient for re-root canal therapy. And also in a radiographic examination there is a slight apical resorption had been seen with respect to for the periapical region of 3.1 and 3.2, that is a mandibular left central incisor and lateral incisor. So on the day one what we have done is we had given a local anesthesia, and we regained the access with the help of a small round burr, and we removed the entire previous restoration material, and we had done cleaning and shaping for the respective of the both the teeth. And we had placed a calcicure from that is Endo company, that is a water soluble calcium hydroxide intracanal medicament, and we advised the patient to recall after 1 week. So after 1 week the patient complains of no pain and no swelling, so we regained into the access chamber by removing the temporary restorative material, and we had removed this entire water soluble calcium hydroxide intracanal medicament with the help of normal saline, followed by the irrigation protocols, which is done by using a 5.25% of sodium hypochlorite and 17% EDTA liquid, followed by complete drying the canals with the help of pepper points. So after a master cone checkup, what we have done is that as there is a apical resorption had been observed, so we had placed BIOSTRUCTRE MTA putty material, followed by filling the entire canal with the help of backfill, and we sealed the tooth, and we advised the patient to revisit after 1 month. After 1 month, this is how the entire apical lesion had been decreased, and also at the same time the tooth was firmly intact with no any other changes with respect to for both the teeth, and the patient is also happy. So next, coming to this BIOSTRUCTRE MTA material, this BIOSTRUCTRE MTA material is available in powder and liquid form, which can be easily mixed on our respective mixing pads, and it can be carried by with the help of MTA carrier or any other amalgam carrier. Recently I have done using this BIOSTRUCTRE MTA putty material in one of my patient. Here a 70 years old male patient visited to my clinic with respect to his fractured tooth in his right upper front tooth region. On clinical examination, the maxillary right central incisor it been obliquely fractured had been seen, and while taking the history of the patient revealed that he underwent trauma some couple of years back, and right now he is getting intermediate swelling in his right upper front tooth region. So we performed cold test and electronic pulpal testing with respect to this maxillary right central incisor and right lateral incisor. Both the teeth are failed to elicit any response with respect to for the both the test. So we had taken the radiograph. So on the radiographic examination, it revealed that there is a well-defined radiolucency had been seen with respect to the periapical region of maxillary right central incisor, which is having a wide and open apex, and these periapical radiolucency is involving the periapical region of this maxillary right lateral incisor. So we advised the patient for a root canal treatment with respect to for the both the teeth, and patient is also agreed. So under a local anesthesia, we had placed a rubber dam isolation. After rubber dam isolation, we gained the access for the both the teeth, and we had removed all the necrotic debris and the pulpal remnants for the respect to for the both the teeth. And while coming to the cleaning and shaping mechanism, here in the wide and open apex, we can't directly use the higher concentration of sodium hypochlorite, as it can leach into the periapical radiolucencies. So here what we have done, we had used 0.1 percentage of sodium hypochlorite in a controlled manner. So after cleaning and shaping, we had dried both the canals, and we had placed a calcicure, that is water soluble calcium hydroxide intracanal medicament from Safe Endo company, and we advised the patient to recall after 1 week. After 1 week, the entire calcium hydroxide material had been completely removed, so with less period of time with the help of normal saline, followed by the irrigation protocols. And while coming to the obturation of this maxillary right central incisor, we had placed MTA material for 3 to 4 millimeters, as an it can create a barrier. So after getting the material get set, so we had filled the entire canal by using this backfill, and we sealed the teeth. Next, coming to this maxillary right lateral incisor, we had placed bioactive root canal sealer from the Safe Endo company, and we had sealed this entire tooth with the help of cavity restorative material. And this is how the entire obturation get done within only single visit, especially for the patient. So it gained the majority of the patient time, and also at the same time it can be easily helpful for the clinician to handle this type of material in his clinical practice, as it is having a good setting period of time, and also at the same time while seeing in the radiograph, it is having a good radio opacity levels.